Hey, Dr. Steve, how are you today?
All right, Michael. Good to see you.
Good to see you too. Steve, I'm really excited about talking to you today about the topic of stress and the idea of what heart math is. We talked a little bit about that, but I really want you to go into more detail about that. And so just tell me a little bit about you, Steve, really quickly.
Actually, I'm a wellness chiropractor. I was a community health educator before I became a chiropractor. And at the time, it was the early 1980s, and I had developed a wellness education program for the whole population of the town that I grew up in West Orange, New Jersey. So I had a chance to present wellness education way back in the early 1980s to senior citizens, to every age population group, to kids, which I loved. And then I realized I loved the teaching aspect, but also realized that I liked working with people one to one. And that led me to go to a natural healing type field in the field of chiropractic. So I attended Life University, which I loved every minute of it. And here I am today, 33 years later, after beginning practice in 1985.
Wow, wow. So what specifically do you love about the wellness aspect of things?
You know, like the idea of being, optimizing our health, being self-sufficient, not dependent on anyone. More than that, just living in a way where you actually feel like you're fulfilling your life. So the ultimate end of wellness I see is not just being healthy for yourself, but actually the ultimate is extending a healthy influence into the world. And if more of us are doing that individually, the idea is that's what causes world transformation.
Hmm. How do you think that could be done? Like, I guess, how do you teach that to individuals? The idea of spreading that
That's
idea.
that's where heart math comes in. And this past year, I developed a course, Stress Mastering, Fulfilling Your Life, and I'll be coming out with a packaged course soon in that respect there. But the the way to do it, it takes some training. And with heart math, it talks about coming into a state of coherence, physically, mentally, emotionally, and really spiritually. So there's training in that respect to see what it takes to be in that way where you're actually extending a healthy influence and you actually see you're extending a healthy influence by using the heart math technology.
Okay. Now, that technology, what is it? Is it like a neural type of technology? What does it do?
It measures heart rate variability, and you connect it to your ear, and it picks up your pulse. But it picks up more than your pulse. It picks up your heart rate rhythms. And what we know is that the sequence of each heartbeat should be slightly different. If it was exactly the same, you'd be near death.
Okay.
The healthy variability is between each heartbeat, each sequence of heartbeats, the more healthier a person they have in terms of resilience, adaptability, being able to make decisions, being clear in that respect.
How would you say, like, we focus a lot on the idea of optimizing performance. How can, how does heart math help us to optimize performance? What is it, I guess, what does it decrease? Does it, what's the benefits of it?
Okay, that could be answered in a variety of ways, Michael. Now, let's we'll back up a little bit. There's relaxation techniques, and relaxation is good. It can put you into healing mode, but you can't go around feeling relaxed all day long or being in a somewhat meditative state.
True.
We need to be functioning high level within our businesses or within our work. And so being in coherence can relate to when you are relaxed, but also when you're, say, in a high level event. And I know that you work with athletes. Is that correct, Michael?
Athletes and executives.
Yes. So in terms of optimizing your performance, you want to see what it takes to do that. And part of doing that is having your heart rate rhythms in their optimal coherence. They use the term coherence, which is a scientific name for basically your heart being in its right rhythm.
Okay. So what I like about what you're describing is that it's an evidence-based approach. So One thing that you mentioned that I thought was really cool and I thought was very interesting is the fact that you're unifying all aspects of the person, but you also said that there's a link between the spirit and science, which I mean that's a huge thing. When you think about spirituality in the 21st century.
Yes, that relates to my chiropractic work, and chiropractic and heart math, I see going along perfectly, because chiropractic, really, the essence of chiropractic is to help acknowledge the innate potential of each person, the innate essence, and allowing that to come into expression. My chiropractic mentor, Dr. Bill Bain, would say basically the cause of disease is the interference to life expressing through a person.
That's deep.
So you want to set the conditions for that person's own innate character to come out. And when it comes out, it's not a matter of that person doing it all by themselves. It's actually being in a mode where actually your part that you're playing with others. It's our influence together. That sets the stage, again, for something large, integrative happening in the world, and to know what it takes in that respect. So when it comes to science and spirit, when you get into a state of coherence, it actually allows a person to connect with their own innate intelligence in chiropractic terms, or their own innate wisdom in conventional terms.
Wow. Do you do you do anything, do you guys ever do stress tests like with kinesiology types of functions?
Absolutely, yes.
Can you tell me, so I went to a training a long time ago, and this gentleman, he was doing, he was sports psychologist actually, and he had us stand up and we would say certain words.
Yes.
And depending on the words, it would impact our muscles.
Yeah.
Tell me, how does that work? Like,
I guess, have you been exposed to the book Power versus Force?
I have that book, yes.
Yeah.
I haven't read it yet, but I do have it.
That's the most sensible way of describing how muscle testing works there. And, yes, no questions for the body. You can actually see what works, what doesn't, just by allowing a framework of using yes and no questions. So for some folks, for some individuals, I'll check a supplement. They'll put it next to their heart. They'll put their arm out like this, and I'll check to see, does that supplement make that person weak, or does it hold strong? So that's one way of confirming if something is good for them. Another way that I do it even without muscle testing is I'll lay a supplement on a person's body, and I'll look at their body language. As a chiropractor, we look to see for leg lengths. And if that supplement's not good, one leg will draw up. It's amazing how it works. Without even me touching the body, if that supplement is incongruent for that person's energy field, the person's leg will get short.
Wow. So it's almost like the body unconsciously tells us what we need or what's good for it and what's not good for it.
Subconsciously, yes.
Wow.
Dr. Moore, to the work that I do chiropractic, I use the BEST technique, which stands for Bioenergetic Synchronization Technique, developed by Dr. Mortar. And he would say that basically, everything is energy, and you want to have congruent energy there. Now, what I found out too with muscle testing, always there's some input on the part of the practitioner, the observer. I don't know if you studied quantum physics.
Yes, I'm reading a book. Well, I'm reading a book about by Bruce Lipton actually, on that particular topic.
Yeah. So like, the practitioner can actually have an influence by their actually own thought patterns. So when I do muscle testing, I use it as a screen, where, as a screen where it's not 100% conclusive, but at least it gives us some data to see what could be helpful for a person. Now, I couple that with looking at blood work, where blood work is totally objective. You can't influence it by your own thought patterns, basically. So I couple my muscle testing with looking at conventional blood work to see if a person's in optimal values versus clinical values. And how that works is, when you go to a conventional doctor and they look at your numbers there and they see you may not be feeling well, but they see everything falls within normal, they say you're fine, just maybe all in your head. but there's ways of looking at blood work to see if a person's lined up with optimal healthy values. So there's ways of helping to guide a person in that direction and seeing what's underneath the surface of why they might have digestive concerns, why they might not be thinking clearly, So usually I like doing both. So just to add a little bit to your question there, Mike.
Wow, I really think that's pretty interesting, Dr. Ventola.
Yeah.
What I wanted to do is just have you briefly talk a little more about the course that you're going to be offering before we wrap up. What's that? Tell us a little, what is this course going to be specifically? Who's it geared towards?
My tagline is it's for integrity-minded individuals. Along with my patients, I do offer a once-a-month public session here in town called Master Stress with Heart Math Meetup. So it would be for those folks who are in that membership there, and really for anybody who's interested in knowing they can handle stress better, and in turn, knowing more how to be in coherence, which would elevate their health. But more importantly, if they're more in coherence, they're going to extend that healthy influence. So the end aim of the course is helping folks to remember that they have an influence to extend into the world. And if they're extending a healthy influence, it actually assists them to know their own fulfillment moment by moment, day by day. So a title that I have, working title so far, is the course is titled Stress Mastering Your Influential Fulfillment.
Sounds beautiful.
Yeah.
I might have to take that course, Doc.
Yeah.
That sounds really, really amazing. Thank you so much, Dr. Steve, and we'll have to get together and talk again another day.
Sounds great, Michael. Thank you.
Take care. Bye.
Bye.